So this is our Tibialis anterior foam roll. So from this position, I'm gonna start by just resting on my shin and then turn my body a little bit to the side so I don't hit the shin. But I can feel that I have the roller on my muscles on the lateral side, meaning the outside of my shin. From here, I'm gonna try to keep the roller as close as possible to my knee and then apply pressure and slowly roll down my shin here and find the first sore spot closest to my knee. So especially if you have any knee pain, then we want to target the muscle part that is closest to the knee and try to release the tension or the soreness in that area first, because that can help a lot with the sensation in our knee. So I just find the first sore spot, and then I can use my other leg to rotate in and support my foot so I can apply even more pressure here. And then I'm going to take a couple of deep breaths to desensitize. Inhale with my nose, exhale with my mouth. Do that a couple of times just to tell the body that everything is okay, so it doesn't fight the roller too hard. And then I'm going to do some contract relax cycles. I'm going to do a 4-second inhale, hold my breath, and then try to contract my leg. So I'm fighting the roller now for 4 seconds. And release. And then when we release, we try to exhale for 8 seconds and really relax for 8 full seconds here. And if you need to find your breath, take a couple of deep breaths before you do the next contract relax cycle. 4 seconds in, contract, fight the roller for 4 seconds. And then relax for 8 seconds and try to get deeper into the tissue. So we're going to do that for 2 to 4 reps. And then if everything feels good after 2 to 4 reps, then we can continue on by applying some movement here. So what we can do in this instance, what I really like here, is trying to scrub our shin from side to side. So we're actually trying to pull the roller across the tissue here. So I'm going to scrub from side to side. You can even try to imagine that you had a scratch on your leg and you're trying to scratch it. And you're going to do that until you feel like, okay, now it's not as sore as when I began. And then we can take the roller and then we can move further down towards our foot, find the next sore spot, and then we can repeat the entire process here. So we begin with a couple of deep breaths to desensitize. Then we do 2 to 4 contract relax cycles. If you're really tender and sore, you can do more of the contract relax cycles. Just make sure that you continue until the highest spot that you feel is sore has begun to feel better. And then you can continue by scrubbing from side to side. And then if you have more time, then you can continue down the shin muscles here, the tibialis anterior, all the way until you get closer and closer to your ankle. So that is our tibialis anterior foam rolling.